Hello, my name is Sarah, and I'm going to be your occupational therapist today. Your name's Miss Abbott, right?
Yes.
Okay, Miss Abbott, can you tell me your date of birth and today's date?
12/12/97, and today's date is October 29th.
Okay. And I understand that you've had a reverse total shoulder replacement in your left arm. Is that correct?
Yes, I had this procedure done 10 days ago, and I am experiencing some pain in my shoulder and some bruising. Is that bruising normal?
Yes, it's normal to have bruising, especially after a surgery as involved as you've had. The pain is also normal. I'm going to be asking you some questions about your injury and how it's affecting you in your daily life, okay?
Okay, that sounds good.
First, I have some precautions for you to follow after having your surgery. You aren't to lift anything with your injured arm for the first 4 weeks. Also, you're at a higher risk for shoulder dislocation. The main thing to remember with this is to not bring your arm behind your back. And you're going to want to follow this precaution for a total of 12 weeks. Also, you need to keep your sling on at all times for the first 2 weeks after surgery, except to bathe and perform your exercises. Also, you're not to soak or wet your arm for the first 2 weeks after surgery. You're also not supposed to submerge your arm in water for the first 4 weeks following surgery. Do you understand all these precautions?
Yeah, I think I can remember to follow these, but can you write them down for me?
Yes, I'll send you home with sheets that give you the instructions. Can you rate any pain you're experiencing today on a scale from 0 to 10 for me? 10 being the worst pain you've ever experienced in your life and 0 being no pain at all.
I think I'd probably be a 7.
All right. Are you right-handed or are you left-handed?
Right-handed.
Okay. And what's your current living situation?
I live in a one-story house with my sister and my roommate.
Okay. And has your limited range of motion affected your daily life at all since having surgery?
Yeah, I haven't been able to cook and clean and put on and off my shirt. I'm okay with lower body dressing because I can use my unaffected arm, but I can't lift the skillet or any pans to put in the oven, and our washer and dryer is stackable, so it's really hard for me to reach up and get all the clothes out of the dryer. And sometimes it's hard to fold with one hand because I can't get them all straight. I can put things on hangers, but when it comes to like folding different t-shirts and stuff, I can't really do it. And the microwave is above the stove, which makes it hard for me to lift with my left arm. Even though I'm right hand dominant, sometimes bowls require 2 hands.
All right, and this is a part of the evaluation that I would normally go over range of motion. The important range of motion with the total reverse shoulder replacement would be assessing shoulder flexion, extension, abduction, and adduction. And you don't want to do internal or external rotation. And now I'm going to palpate the humerus, which is this bone on the arm right here. Also, you have the rotator cuff muscles, which include the deltoid, the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. All of these are really important once you have the total reverse shoulder replacement surgery. All right. Also, the 2 frames of reference that I'm using during the evaluation today are the rehab frame of reference and the adaptation frame of reference. Now we'll be going over the quick dash to give me more insight into your normal occupations. And for video purposes, we will only be going over the first part of the quick dash. All right, Miss Abbott. So you're going to rate each one that I list on a scale of 1 to 5. 1 being no difficulty and 5 being unable to complete. So the first one is open a tight or a new jar.
I can't do it because I would have to be able to be out of my sling and have full use of my arm.
Okay.
So unable.
All right. Do heavy household chores such as wash walls or floors.
I think some of those would be pretty painful to be on the floor and then to have the washing motion, so probably unable.
Okay. What about carrying a shopping bag or a briefcase?
I can't have any weight bearing or anything until 4 weeks, so I can't do that yet.
Okay.
Unable.
What about the use of a knife to cut your food?
I might be able to do that if I had a assistive knife that I didn't have to saw back and forth. So maybe like moderately or severe. It just depends on what I'm cutting.
Okay. And we skipped one. What about washing your back?
I can wash my back pretty good with my right arm because I have one of the long handled brushes. But if I was needing to reach somewhere where I needed my left arm, it would be pretty hard.
Okay. And the last one. Recreational activities in which you take some force or impact through your arm, shoulder, or hand, such as golfing, hammering, or tennis.
No, I'm unable to do all of those.
Okay. Now I am going to talk to you about some ways to help you relieve your pain you're experiencing. To help relieve pain before, during, and after therapy, you can use cryotherapy or the use of cold packs. These should be used frequently, up to 4 to 5 times a day, and for 10 to 20 minutes. And when you apply the cold pack, you always want to make sure to wrap it in a towel and not apply it directly to the skin. You also shouldn't use cold packs if you have any cold sensitivities or a past history of frostbite. We're not going to be using hot packs because this is going to increase blood flow to the site of surgery, which is going to cause you more pain. There's already going to be swelling and inflammation, which will cause heat to the surgery site, and we don't want to add more heat to this. We also won't be using ultrasound or E-stim with you either, due to your surgery site not being fully healed and you haven't had your stitches out yet.
Okay. Can I have the ice pack can I leave the ice pack on for less than 20 minutes, or does it have to be 20 minutes exactly?
Yes, if it starts to feel too cold, you can pull it off at any time. It's just important to remember to have it wrapped in a towel and for not to leave it on for more than 20 minutes.
Could I do it in like increments? Do 10 minutes here and then wait and then do 10 minutes?
Yes, that's perfectly fine. Okay, now I'm going to be discussing some interventions that we'll be using during your time in therapy. I'll be teaching you how to use some adaptive equipment, such as the use of a sock aid, and how to use a dressing hook, or teach you alternative methods of donning and doffing a shirt, which is taking on and putting on a shirt. Taking on and putting on and taking off your shirt. I'm so sorry.
It's okay.
I'll also be teaching you, we'll also be working on increasing your range of motion, which will include gentle stretching exercises, such as a pendulum swing, which is you're just going to have your arm down out of your sling, and we're just going to swing it in a circle. And we will be progressing as you continue therapy. We'll also be working on some strengthening exercises and incorporating weight into those as you progress.
Okay, will I have exercises to do at home as well?
Yes, I'll send home sheets with instructions of how to complete exercises at home as well as in therapy. These are the 4 goals I would set for you to achieve during your time in therapy based on the information I've gathered during the evaluation. You will increase range of motion and strength to functional range in the shoulder via 3 exercises a day for 15 minutes each, so you can independently place things in the microwave and oven without the help of others. You will also learn adaptive strategies via therapy sessions to help you don and doff your clothes independently as well. I will also be teaching you adaptive strategies via therapy sessions to help you drive independently as well. Your last goal that I would set for you is to increase your range of motion and strength with exercises to allow you to independently complete housework. And these are the goals that I would set for you. Did those sound okay?
Yeah, they sound really good. How many times will I need to come to therapy?
You'll need to come 2 times a week for the next 4 weeks, and it doesn't matter what day. You can choose those. We need at least one rest day in between your visits. And after the 4 weeks is up, I will reevaluate you and we'll discuss if we need to further treatment or if you can be discharged.
Okay, sounds good.
All right, it's been great to meet you, Ms. Abbott, and I will see you next week for your first therapy session.
Thank you.